Today we are going to talk about hypertension. Blood pressure is the force exerted by circulating blood against the walls of the body's arteries, that is the major blood vessels in the body. Hypertension is when blood pressure is too high. Blood pressure is written as two numbers. The first systolic number represents the pressure in blood vessels when the heart contracts or beats. The second diastolic number represents the pressure in the vessels when the heart rests between beats. Hypertension is diagnosed if when it is measured on two different days, the systolic blood pressure readings on both days is greater than or equal to 140 mmHg, or the diastolic blood pressure readings on both days is greater than or equal to 90 mmHg. If systolic is below 120, it is considered normal. But if it extends 120 and reaches 130, it is considered as elevated blood pressure. Also, when it again extends 130, it is considered as stage 1 high blood pressure, and when it reaches 140 or higher than that, it is called stage 2 high blood pressure or hypertension. Risk factors in hypertension is categorized as modifiable risk factors and non-modifiable risk factors. Modifiable risk factors include unhealthy diet, excessive salt consumption, or diet high in saturated fat and trans fat, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, being overweight or obese, whereas non-modifiable risk factors include family history of hypertension, age over 65 years, coexisting disease such as diabetes or kidney disease. Hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. When symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. The only way to detect hypertension is to have a health professional measure blood pressure. Having blood pressure measured is quick and painless. Individuals can also measure their own blood pressure using automated devices. However, an evaluation by a healthy professional is important for assessment of risk and associated conditions. Complications of uncontrolled hypertension include serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause chest pain, also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage to the heart. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital body organs. Irregular heartbeat, which can lead to a sudden death. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure. WHO region of Africa has the highest prevalence of hypertension, that is 27%, while WHO region of the America has the lowest prevalence of hypertension, that is 18%. So, how can we reduce the burden of hypertension? We can reduce it by preventing or by managing. Prevention of hypertension can be done by reducing salt intake, eating more fruits and vegetables, being physically active on a regular basis, avoiding use of tobacco, reducing alcohol consumption, limiting the intake of foods high in saturated fats, eliminating or reducing trans fats in diet. And hypertension can be managed by reducing and managing mental stress, regularly checking blood pressure, treating high blood pressure, managing other medical conditions, and practicing exercise on a regular basis. How are high blood pressure and exercise connected? Regular physical activities makes your heart stronger. A stronger heart can pump more blood with less effort. If your heart can work less to pump, the force on your arteries decreases, lowering your blood pressure. Discover how small changes in your daily routine can make a big difference. Your risk of high blood pressure increases with age, but getting some exercise can make a big difference. And if your blood pressure is already high, exercise can help you control it. Don't think you have got to run a marathon or join a gym. Instead, start slow and work more physical activity into your daily routine. Exercise prescription for individuals with hypertension. In individuals with hypertension, the following exercise prescription is recommended, which includes aerobic and resistance exercise. Aerobic exercise on most preferably can be done all days of the week, whereas resistance exercise 2 to 3 days per week. Exercise should be carried out with moderate intensity. Aerobic exercise, that is 40% to less than 60%, supplemented by resistance training at 60% to 80% of 1 RM. Continuous or intermittent aerobic exercise can be done 30 to 60 minutes per day. Resistance training should consist of at least one set of 8 to 12 repetitions for each of the major muscle groups. Emphasis should be placed on aerobic activities such as walking, jogging, cycling, and swimming. Resistance training using either machine weights or free weights may supplement aerobic training. Such training programs should consist of 8 to 10 different exercises targeting the major muscle groups. The FITT principle of exercise prescription relating to progression for healthy adults generally apply to those with hypertension. Consideration should be given to the level of blood pressure control. Progression should be gradual, avoiding large increases in any of the FITT components of the exercise prescription, especially intensity for most individuals with hypertension. Activities like weightlifting and squash are not good for your blood pressure. There are also some contraindications for the person with hypertension. Absolute contraindications to aerobic and resistance training programs include recent myocardial infarction or electrocardiography changes, complete heart block, acute congestive heart failure, unstable angina, and uncontrolled severe hypertension. An individual with blood pressure more than or equal to 180 per 110 mmHg should completely avoid training programs.